Dr. Nicole Eisenbrown with Advanced Urology Institute. Now for overactive bladder, that's a completely different problem. And the American Urologic Association has guidelines on how we're supposed to address that. The first thing that they recommend are lifestyle changes along with pelvic floor strengthening. The lifestyle changes are things like managing constipation, avoiding caffeine and other stimulants, timed voiding, those types of things. The pelvic floor strengthening, the reason that's so important is because our bladders know what to do without us. And the reason we develop overactive bladder is that the pelvic floor is no longer strong enough to control those impulses. So if you strengthen the pelvic floor, you gain the control over your bladder again. Also, every time you exercise your pelvic floor, you actually send a calming signal to the bladder. So doing that systematically is another way that pelvic floor strengthening will relax the bladder. The second-line therapies are all the medications. You've all seen the commercials on TV, the little lady following her bladder around. We are very blessed now that we have probably at least 12 or 13 medications on the market. They all work fairly well, so we generally can find something that works with minimal side effects and that their insurance company will pay for. Then there are third-line therapies. There are three. InterStim is one, which is where we stimulate the nerve that goes to the bladder. I kind of think of it as a pacemaker in that there's a battery and a lead. There's Botox, which is, it's not just for faces. We can inject it into the bladder and that will partially paralyze the bladder. And then there's a procedure called percutaneous tibial nerve stimulation, which is an office-based procedure where we stimulate the nerve for 30 minutes once a week for 12 weeks. We don't usually go to the third-line therapies till we've fully exhausted pelvic floor strengthening, lifestyle modification, and medications. But it's important for people to know that there is a list of things that we can try, and we can generally help somebody as long as they keep working with us.